Cardiovascular Consultants presents its Patient Education Series. Dr. David Brill discusses transradial cardiac catheterization.
A new procedure is developed called transradial catheterization. Transradial refers to using the radial artery, which is located in the wrist, on the outer aspect of the wrist when the arm is hanging down from the side. It is the artery that delivers blood to part of the hand. Now, fortunately, there are actually two arteries which deliver blood to the hand. There is a radial artery on the outside and an ulnar artery on the inside. And these arteries then join together and they meet in the palm to form a connection or a loop. It is possible for one of these arteries to be used to thread a catheter up to the heart. The radial artery is very superficial, it can be very easily anesthetized, and it is very simple to insert a catheter into the radial artery, even in patients who are obese and have a very high body mass. The radial artery, once it is anesthetized, is very suitable for us to thread a special type of IV through the skin, which the patient will not feel. We can then exchange the special IV that we put in for a larger sized special IV referred to as a sheath. Through the sheath, we can then insert the catheters that go up to the heart. So the radial procedure is different from the femoral procedure in that we are using the radial artery in the wrist as opposed to the femoral artery in the groin. Everything that we do in terms of the catheterization procedure or the interventional procedure that involves the insertion or implantation of a stent is virtually identical. We use slightly different catheter shapes, but the procedure itself is very similar in terms of the results achieved and the outcomes for the patients. After the procedure, the little sheath that is in the wrist is removed and a special Velcro wristband is attached to the wrist with an inflatable cuff located over the area where the radial artery is. The cuff over the radial artery is inflated. It applies pressure to the puncture hole and allows it to seal up over a period of 1 to 4 hours. So after the radial procedure, when the wristband is applied, the patients can sit, they can stand, they can walk and use a bathroom, they can eat. We prefer for them not to use the right hand. They can still move the fingers, move the wrist, and move the arm, but we prefer that most actions be done for the first few hours with the left arm. But you can bend the elbow, move the shoulder, and patients are very comfortable. The procedure itself is more comfortable than the catheterization performed via the groin artery, the femoral artery, because patients don't need to lie flat. Patients with bad backs, patients with knees and hips that are uncomfortable when they have to lie still and flat on their back, these types of patients are extremely comfortable and far prefer the radial artery procedure. The transradial approach allows the patient to sit up. They don't need to be heavily medicated with pain medications afterwards, and they have no difficulties using the bathroom. Also, and I would say this is really the greatest benefit of the radial procedure, is that the risk of bleeding is far less when we use the radial artery because it's superficial and because any bleeding can easily be detected and because the radial artery can be compressed with 1 or 2 fingers just with light pressure over the radial artery. The risk of bleeding is much less.